When we think about a dental cleaning, most of us picture a quick scrape and polish, right? Something to make our teeth feel all slick and clean. But what if I told you that appointment is actually one of the most critical health screenings you can get? Today, we're going to look at exactly what your hygienist sees that you just can't.
So, you're diligent. You brush, you floss, maybe you even use that fancy mouthwash. You're doing everything you're supposed to, so your bases are covered, right? Well, that's the big question. Is even the most perfect home care routine really enough to keep you in the clear?
Here's the scary truth. By the time you actually feel pain in your mouth, a problem has likely been brewing for months, sometimes even years. The real dangers are the ones that are totally silent, the ones that are growing in places you'd never ever see in your bathroom mirror.
All right, so let's pull back the curtain a little bit. We're going to get into the specifics of why your home care, even if it's amazing, has some serious limitations. This is all about the stuff that only a trained professional with their specific tools can catch. Okay, so meet public enemy number one, tartar. You might also hear it called calculus. Basically, when that fuzzy plaque hangs around on your teeth for just a day or two, it starts to harden. It literally calcifies. And here's the key takeaway. Once it turns into tartar, your toothbrush and floss are completely, totally useless against it. It's like concrete bonded to your teeth.
And this stuff is really sneaky. It loves to build up in all the hardest to reach places. We're talking deep under the gum line, wedged in between your back teeth, and especially behind those lower front teeth. These are the hot spots where trouble quietly gets started. But really, the single most critical area is the one that's a total blind spot for you. That little space beneath your gums. This is the hidden zone where tartar causes inflammation, creates pockets, and can even lead to bone loss, all happening completely out of sight. You just have no way of knowing what's going on down there.
And it's not just about the tartar. Your hygienist is on the lookout for things like microscopic cracks from grinding your teeth at night, or tiny fractures along the edge of an old filling. To you, these are invisible, but to a professional, they're giant flashing warning signs. They're basically open gateways for bacteria to sneak in and cause major decay.
And this is why we really have to change how we think about this. A cleaning appointment isn't just a cleaning. You gotta see it for what it is, a full-blown diagnostic evaluation in disguise. Every single time you sit in that chair, your hygienist is performing a detailed health screening. And the scale of what they're looking for is just huge. Get this, the CDC says that almost half, 47% of adults over 30, have some form of gum disease. And the craziest part? Most of them have absolutely no idea. They don't feel a thing.
So what are they finding? Well, for starters, early gum inflammation. I'm talking about super subtle signs you'd never notice, like a little puffiness here, a bit of extra redness there. They use this special little measuring tool to check the pockets around your teeth. A healthy pocket is tiny, like 1 to 3 millimeters. But if those numbers start creeping up, it's the first sign that disease is setting in, long before it ever hurts. Next, they're like detectives, inspecting all your old dental work. I mean, think about it. That filling you got 10 years ago, nothing lasts forever. Over time, the edges of fillings and crowns can start to pull away, creating tiny little gaps. A hygienist can spot that leak before bacteria gets underneath and destroys the tooth from the inside out. They're also hunting for signs of grinding or clenching. A lot of us do this in our sleep and don't even know it. They'll see things like flattened tops on your back teeth or tiny little chips along the edges of your front teeth. These are clues that you're putting your teeth under incredible stress, which can lead to serious fractures later on.
And this one is so important. A huge part of every hygiene visit is an oral cancer screening. They carefully check your tongue, your cheeks, the roof and floor of your mouth, everything. They're looking for any unusual spots or lumps. Most early signs are completely painless, which is why this screening is absolutely vital. Catching it early can literally be a lifesaver.
So, why is catching all this stuff early such a big deal? Well, because dental problems almost never stay small. They have this predictable way of escalating, and it usually happens in 3 clear phases.
Okay, check this out. In phase 1, everything's easy. You've got a bit of tartar, maybe a tiny cavity. The fix is simple, it's fast, and best of all, it's inexpensive. But if you let that slide, you drift into phase 2. Now we're talking deeper pockets, failing fillings, maybe even some bone loss. The fix is more involved and definitely more expensive. And if you wait until you feel pain, well, welcome to phase 3. Now you're facing severe decay, infections, and there's a good chance you might lose the tooth entirely. This right here, This is your hygienist's real job. It's their superpower. Their most important mission isn't just to polish your teeth. It's to keep you out of trouble. It's to find and stop every little issue while it's still small, simple, and firmly stuck in phase 1.
So when you put it all together, what's our best line of defense? It all starts with realizing that your regular hygiene appointment is so much more than just a cleaning.
I think this slide just nails it. The common perception is that it's just optional maintenance, a simple polish. But the reality, it's an essential preventative medical screening. Its whole purpose is to save your teeth from big, painful problems down the road.
And look, we all know why it's so easy to skip these appointments. Life gets crazy busy, nothing hurts, so we think, what's the rush? We worry about what it might cost, or we just convince ourselves that our brushing at home is good enough. These are totally normal reasons.
But here's the ultimate irony. Skipping that preventative screening is the one thing that basically guarantees the outcome you're trying to avoid. When you wait for pain, you are actively choosing to wait until the problem hits phase 3. And that's exactly when you get hit with emergencies and those major dental bills.
This quote from Dr. Miriam Sifi just says it all, doesn't it? Early care is the difference between saving a tooth and losing it. It's that simple. It's not about perfection, it's about prevention. Catching something early is often the only thing that matters.
So think of your hygienist as your personal health detective, the frontline defense for your mouth. They are trained to see what's coming, to spot the tiny red flags of a developing problem long before you ever could.
And that kind of leaves us with one final question to think about. Those silent problems, they're there, growing under the surface, whether we're paying attention or not. So the real question is, what is your hygienist waiting to tell you?